my final addition to my daily diet was Siberian cedar oil resin. Just 2 years ago, I added to my daily diet, and I am very happy about that. What the Siberian elixir of life is, it's a blend of 4 major ingredients. First, it's a red Siberian cedar sap. Probably you know what tree sap is. If you remember when you were a child and you walk among the trees in May or April, and any scratch of the bark produce some drops of sap from the trees. Cherry trees produce very good and pleasant sap. You can eat it. But sap coming from cedar or pine, it's not. But it's very healthy. With time, it became like a rock.
Yeah.
So it should be some sort of diluted. So Russian people dilute this sap in oil. And oil they press from cedar nuts. I'm not sure you're familiar with Siberian.
No.
So Siberian, it's a very popular plant in Eastern Europe, North China, and North Mongolia. They collect these fruits and press oil from their seeds. Very good stuff. So 2 types of oils, propolis and Siberian red cedar sap, they mix together and stay for 6 months.
Okay.
That's how they prepare such blend. And finally, since last year, this thing is available now here in the United States of America. Russian American population familiar with that. But my point is how to provide such information to American people who speak English, whose English is a first language. That's why I ask assistance, and now we are talking about it.
Right.
But my major point was, if it's possible somehow to reach those people who make a decision in our country about alternative medicine has also rights to be a medicine. Somehow let people to go to naturopathic doctors with the same insurances as they go to medical doctors. Is it possible to fight with our pharmaceutical lobby just to give us a little bit more spot on the planet to make our nation more healthy before coming to doctors, not after?
I think it's difficult, that road to hoe. That one is tough because the system is designed in such a fashion as to treat illnesses, not cure them, it seems.
Exactly.
So it's like this: the premise to make insurance company do a different job seems far-fetched to me, because insurance helps people pay to treat illnesses, not to cure illnesses. And insurance company is interested in maintaining the flow of cash and not causing it to diminish.
I really wonder if vehicle construction companies somehow been required to introduce a safety belts in their cars.
Yeah,
Because following such logic, it should be not.
goes like this. Is my estimation of it is this: people who want an agency to do something are giving away their own agency and not taking care of their own expense to take care of themselves. So the individual is responsible for the individual and for their family ultimately, and cannot expect the insurance company to do a better job than they are willing to shoulder and burden the expense. Does that make sense?
I do understand what you said, but at the same time, my brain cannot accommodate such statement.
Huh?
It's like, I don't know, we live in 21st century, so the society should govern, should perform much better on that. We should protect ourselves, and protection means prevention. So
no, is a moral. That's a moral statement when you say should. Okay, and it is. Insurance company is not part of a church. Okay, and so it's like this is idealistic assertion, right? So is it expectation of insurance company to perform to ideal is not a reasonable expectation by my standard of understanding. Because the insurance company is a human institution that is prone to human foible. And so we'll fall short of ideal. It must fall short of ideal. And
well,
so the issue is this: the humans must take up responsibility themselves for their own well-being and not expect the institution to pick up the slack. That's how I see it. Because it's like I can't expect, because you're competing with pharmaceutical industry has billions of dollars to twist the institutions to their own ends.
That's a completely different concept.
Then
Like,
what?
then it was in my mind. I thought the more progressive society is, then more money, then more attention should be spent on taxpayers. So people should pay for themselves to spend less
Is
on self-destruction and more for enjoy life, to be healthy. So funds should be forwarded in the direction of life quality improvement.
what funds?
A lot of insurance company, as I know, got major fund source from federal and state government, not from members.
I don't know. I don't know about that one. My understanding is they collect the funds from members, and it's corporate organization that largely pays for the health insurance. I think corporates that are like their employees have a benefit, which is the insurance benefit.
I'm sorry, I didn't mention. I'm talking about Medicaid and Medicare. Major insurance company, not privately owned insurance company. Of course, I'm talking about
this one in the United States. It's maybe I don't know, 25-30% Medicare, 25-30% Medicaid, which is for indigent people, and then maybe 50% are combined between private and uninsured.
Yeah.
Right. So we understand each other. It's like this giant political football, though. It's like what Medicare and Medicaid do. The federal government decides a lot of how the medical finance works.
Based on my experience, and I am visiting different places, and I'm talking with zillion people during my business course.
Yeah.
More and more people rely on government now in the United States of America.
Yeah.
That's not 19th century anymore. Nobody is going to fight for their own health and happiness and wellness. They do rely on government more and more, like in my former Soviet Union country. Government became a monster that stepped on any part of our life.
Yeah.
So people never even mind to protect themselves. I look like people crossing a road. They not alarmed. They know that driver gonna stop at the intersection because they are going. They don't even think that the driver could be blind, drunk, upset.
Right.
He just or she maybe not just remember to push on a brake and bumps and their life is ended. They are so assured that the driver gonna stop. The same behavior goes for health. People so much assured that medical service gonna be provided for them even if they don't have any insurance.
Right.
If you don't have money, you admitted to hospital, all services gonna be provided. If you are poor, Medicaid gonna pay everything. If you have something, you have to pay. But people who has something, they think twice before going in any risky things.
Yeah.
They start to vaccinate themselves. They think they take care about their health.
I hope you enjoyed this episode of the Best Medicine Podcast with Bradley H. Werrell, DO. Don't forget to hit like and subscribe below, either over there or over there. Also, if you're interested in a medical consultation with myself, there's also information below.